Hi guys, today I will be talking about some of the career paths available in the healthcare industry. To begin, I want to cover what some healthcare options are and what they look like. For example, some individuals might want to work directly with patients, while others might prefer to work in a supportive, behind-the-scenes position at a healthcare facility. And thankfully, in the healthcare field, we have clinic and non-clinical jobs that will fit anyone's personality during their job search. The healthcare field is such a rewarding field to work in. It is constantly evolving, and being able to make a difference in any role provided in healthcare, healthcare options, and healthcare solutions to the population that we serve is an amazing thing to contribute to. People in the healthcare field are touching lives, helping lives, and changing lives every day. To begin, we're going to talk about some non-clinical healthcare jobs. I'm going to talk about their education and the skills necessary to work in them. The first one is healthcare administrators. Healthcare administrators have many positions under this umbrella of this title for non-clinical job. Their tasks usually oversee the organization or the company's process and flows, projects, financial management, staff coordination, project planning, policies and procedure implementations are just some of the common responsibilities in the healthcare administrator. Education usually consists of a master's degree in healthcare administration. It's usually required to work any course of this job. However, some people take alternate routes by getting master's of business administration with the concentration in healthcare options. Next, we have medical secretaries. Medical secretaries usually consist of managing information flow within the medical offices, just as with any other business office, same scenario, just in the healthcare field. The skills are usually needed that you know how to work with office software skills, that you have some type of medical background knowledge because you are working in the healthcare field and do work with medical terminology. Education consists of usually training is available at vocational schools, training institutes, and community colleges. However, a lot of these skills can be learned on the job through in-house training if the employer allows it, and you are able to get an opportunity to work there, you're able to learn in-house sometimes. The next one is medical transcriptionists. Medical transcriptionists transcribe records pertaining to patient histories and clinical information and data. Skills, they need to know, of course, medical terminology, have that medical terminology background, and the language and writing skills to transfer, abbreviate, and simplify note-taking into a usable format and information for the medical files that they are working with on a daily basis. Education for a medical transcriptionist usually consists of an associate's degree in medical transcription, and most community colleges have this type of program. We're moving on to allied health professions. Allied health professions are healthcare professionals that are not doctors or nurses. They provide diagnostic, prevention, evaluation, rehabilitation, and health system management services to the patients and the people that they provide services for. Allied health professionals fall under two broad categories. You have your technicians that are assistants, and you have your therapist technologist. Some examples so you can better understand of the allied health professions are, for example, a physical therapist. A physical therapist helps people that are injured, people that are ill, to improve their movement and manage their pain. The therapists are often an important part of the rehab, of the treatment process, and prevention of chronic patients with chronic conditions. The next one is an occupational therapist, which is kind of like the same thing. They treat injured people or people that are disabled through therapeutic use of everyday activities. So this is stuff that you would need to do on a daily basis. Like, for example, they help you rehabilitate when you have injuries or something of that nature, like to how to put on your clothing, techniques to strengthen the muscles, and how to put on, for example, your shoes, things of that nature. That's an occupational therapist. The next one is a diagnostic medical sonographers. And what they do, it's diagnostic ultrasounds, which use high frequency sound waves to produce images of inside of the body. The diagnostic medical sonographers, they use instruments that are called an ultrasound transducer to the parts of the patient's body that are being examined. And what they do is that they use this method to transmit pulses that sounds back, that cause echoes, that gives them the images so that they are able to look at it, review it, and give some type of diagnostic to give some type of recommendation treatment plan pertaining to the member's illness, situation, or injury. A dental hygienist cleans teeth. They examine the patient for signs of any oral diseases, of any gingivitis, and they provide preventative dental care to the patients. They also educate patients on ways to improve and maintain good oral health for your mouth, because it's very important. The fifth one is the respiratory therapist. The respiratory therapist interviews and they examine patients that they work with breathing and cardiopulmonary disorders. Their patients range from premature infants with undeveloped lungs to elderly patients who have deceased lungs for many reasons. They also provide emergency care to patients who suffer from heart attacks, who have been in drowning accidents, which is something very common during the summer, or some type of shock. That's what a respiratory therapist does. The sixth one we have is a speech language pathologist. They must be able to listen and to communicate effectively with the patients in order to determine the right course of treatment depending on the level of issue that they have with their speech language impairment. Speech language pathologists, they're usually called speech therapists, and same thing, they assess, they analyze, diagnose, and treat. And they help prevent communication and swallowing disorders starting from children all the way to adults. Now we're going to be talking about the different levels of nursing. Starting with LPNs, we'll work on to RNs, and then we'll talk about nurse practitioners. So an LPN is a licensed practical nurse. They're also known as licensed vocational nurses, which is an LVN. What they do is that they support the core healthcare team, and they work under always supervision of an RN, a registered nurse, MD, a medical doctor, or an APRN, which is an advanced practice registered nurse. And what they do is they just provide basic routine care. They make sure the well-being of the patients throughout the whole of the healthcare process or journey within the facility that they're working at. Education for an LPN or an LVN usually is completing an educational program that's approved by the state, which generally lasts about 1 year for the course. They must also pass an exam after they complete the course to obtain their license before they can start working. That's your typical education. Typical job responsibilities. Again, they provide basic nursing care. They work under the direction of the doctors or the nurses. And the job responsibilities do vary depending the state that they work at and where they work at. A lot of these LPNs and LVNs, you can find them at skilled nursing facilities, providing short-term or long-term care as well. Some of the key responsibilities an LPN or an LVN does is, like, for example, they'll check your vital signs, they'll check if your health is deteriorating or improving, and report back to the nurses or their doctors. They perform basic nursing functions such as like changing bandages, your wound dressings, things of that nature to make sure that the patient is comfortable, the patient's eating, that they're hydrated, taking their meds. They may administer medications in some settings, so it depends. The next one we'll talk about registered nurses. A registered nurse, their basic education is your basic nursing education licensing program that's required for all registered nurses. This usually consists of their nursing degree, which starts with an associate's degree when they get their RN. And of course, later on, they can get their BSN and their MSN in nursing. But the basic to start off, they have to go to the nursing program that is required by the state that they work in, and then they have to get licensed. Typical job descriptions, they work directly with patients, the families, and the communities where the population that they serve is, with core values of the nursing process, which usually provides critical health care to the public anywhere that is needed. They do exams, they review health histories before making any critical decisions, counseling, education. They administer medication, like for example IVs, and other personalized interventions. They coordinate care. They work very closely with other healthcare professionals to provide the services for the members. Nurse practitioners, advanced practice registered nurses. Education for them is usually at least a master's degree, in addition to all of the initial nursing education and licensing that is required for an RN. Typical job responsibilities, usually it consists of primary and preventative health care, treating, diagnosing, assessing, providing medication to the member, managing chronic diseases, engaging in ongoing education for the members or the patients. They are very on top of whatever is being relevantly coming up in the medical industry and healthcare field regarding technology, methodological studies, or other developments in the healthcare field. Advanced practice registered nurses, their roles. For example, a nurse practitioner can prescribe medication. They can diagnose and treat illnesses, whether they're minor or greater injuries. A certified nurse midwife provides gynecological and low-risk obstetrical care. A lot of these are very popular with women that are pregnant. Midwives help them through the process of their pregnancy and then their delivery. They do a lot of Lamaze classes, support. That's one of the types of practices with the registered nurses. Another one is a clinical nurse specialist. What they do is that they handle a lot of different wide varieties of things of physical and mental health problems. Then we have the last one, which is a certified registered nurse anesthetist, which usually administers about 65% of all anesthetics in the healthcare field. So we just went over 4 of the different types of nurse practitioners, which was the nurse practitioner who gives the medication, diagnose, treats minor and illnesses and injuries. We have the certified nurse midwives, which helps people that are, for example, pregnant with the gynecological and low risk obstetrical care. And then you have your clinical nurse specialist and your certified registered nurse anesthetist. That concludes my presentation today regarding non-clinical jobs that are out there in the healthcare field, covering different types of nurses, the LPNs, the RNs, and the practitioners, and covering allied healthcare providers, telling you guys what they are, some examples so you understand. So I hope you learned a lot, and I thank you for your time.